All right. Well, I say we get going. You ready to go, Carrie?
I'm ready. Let's do this.
All right. Well, everyone, thank you so much for joining us on this. It is Wednesday, right? Wednesday evening. I am East Coast. I think most everybody is Central Time, correct? At least a lot of the people joining. So thank you so much for joining us on this Wednesday night. I know it's a little bit later for some. Super excited to talk with you guys about a very hot topic in dentistry right now. This is a joint presentation between myself with DentalHQ and Carrie Webber from Jameson Management. Am I saying that right? Or consulting?
Yes, all those things.
All the things. All right.
You can call us
Well, great.
any of
Well,
those things.
we're both very well versed in this topic, and we've experienced a lot in it, and super excited to talk about it. I think we've got a lot to share. Again, my name's Brett Wells. I'm a dentist in Raleigh, North Carolina. I'm out east. I've got a group practice, several locations, bunch of doctors. We work really hard to provide great dentistry and a great culture and take great care of our patients. And, we've learned a lot along the way and mistakes that we've made and issues we've had to solve. And one of the biggest things we've had to solve in the last couple of years since COVID has been cancellations. So excited to talk about that. I did start, as I mentioned, DentalHQ. It's a company that automates in-house membership plans. We provide automated software, marketing materials, training for your team, and payments and all kinds of stuff. We'll talk more about that way later. I launched that after listening to a presentation from the late Dr. Charles Blair, who was a great friend of mine, and got me into membership plans and learning all about them and the power of them. And I've been a big advocate in launching them and having DentalHQ for many, many years. So that's kind of the inception of DentalHQ. I'm also being an East Coast person. I'm a Tar Heels fan. I'm a Hurricanes fan who are in the playoffs now. We won a big game the other night, and I'm a Carolina Panthers fan, which is just tragic right now. I also love to cook. I have a fantastic banana pancake recipe. If anybody's ever looking for one, feel free to shoot me an email. My email will be at the end. And then last thing I want to mention is a lot of things we're going to discuss tonight, the plan for preventing cancellations. I did publish an article on Inside Dentistry a couple years ago that goes into a bit more depth about this topic and each of the different steps that I recommend going through. So feel free to seek that out. Navigating appointment cancellations and no-shows at Inside Dentistry. So again, I founded DentalHQ back in 2017. We're a much bigger company now, and we've learned a lot of lessons since then. We're an automated platform to help offices manage their in-house subscription programs, and there's a part to play with those and avoiding and reducing cancellations. So we'll talk more about that at the very end. We are endorsed by the Oklahoma Dental Association. We received that endorsement a year or two ago. We're super proud and happy about that. And we've been to several events from the Oklahoma Dental Association. Are excited to get more involved and to host this webinar tonight. So having said that, I'm very excited about my co-host tonight, Carrie Webber. I've gotten to know her and all the great things she's doing and teaching all the dentists and auxiliary staff and admins across the country. She's very, very well versed on this topic. So very excited to be sharing the screen with her tonight, and I'll let her kind of tell more about herself.
Thanks, Dr. Wells. And thanks to all of you for joining us this evening. It's certainly a pleasure to be partnering with Dr. Wells in this presentation on a very hot topic. And, this is a topic that never goes away. And there's always some interest in how to help improve our schedules and be as consistent as possible. So I personally have 24 years in the dental profession, but I love to say that it's really my whole lifetime because my parents are Doctors John and Kathy Jameson, the founders of Jameson. My father's a retired dentist, and a great deal of the foundations of what we have taught over 30 years started in his practice. And so after my dad retired in the early 2000s, we recognized how powerful it is to be practicing what we preach. So my husband and I, who own the Jameson Group, also are partner owners in a dental practice right here in Oklahoma. And we are very proud to do so, to be where we practice what we preach, to make sure that what we teach dental practices and teams and doctors across the country really is relevant and useful in helping them pursue their ideal practice vision. Now, tonight, our OKC Thunder are playing in the playoffs at 8:30 p.m. Central. And so when I wrap up with you people, I'm watching the Thunder. So I don't know how many of my Okies are on this presentation are going to be sharing in that experience with me, but go Thunder. So a little bit more about the Jameson Group. We are over 30 years old as a company, and we have been working with dentists and teams, as I said, across the country and in multiple countries, helping them be more productive, profitable, and ultimately more fulfilled in their practicing lives. We also provide leadership and operations coaching for dentists and dental practice leaders and owners. And for the past 15 years, we've been providing full service dental marketing to dental practices across the country. And in the last few years, we released our online learning platform, Grow by Jameson. And so this is really the portfolio of how we support dentists and teams every single day. I have an amazing team that's going into practices or working directly with dental practices on the daily, and super proud of my team. Super grateful for the work we do with dental practices every day and carrying on the legacy of the Jameson Group. So reducing cancellations and no-shows and those systems and scheduling and the patient experience and building that value for appointments is certainly a part of the wheelhouse of what we work with dental practices on every day.
Perfect. Thanks so much, Carrie. And we're so fortunate to have you on tonight to assist with this chat. The way this is going to kind of go is I'm going to kind of lead the conversation through the different steps and the strategies for preventing cancellation and no-shows. Carrie's going to speak and comment and discuss her views and opinions on each of those steps. There's going to be some steps where we actually have different opinions. And so you'll get to hear both sides of the coin. And, I think both sides are very appropriate and have their place in dental offices. The most important thing I can say is just it's very important to have a plan because prevention, as you'll hear, is the most important component to reducing cancellation and no-shows. Just a little comment before I start of how I got into this topic, which is like many of you, I came back from COVID, didn't even know if we'd be coming back from COVID. It was the most stressful time in my career to date, as it was for most of us. And I noticed a change in consumer mentality of, cancellations went through the roof. They knew if they said they felt sick or pretty much any excuse, we were going to free them from the appointment and not give any pushback about them not coming in. And it kind of created this mindset that's just continued on now, 3-4 years later, that's really been a challenge for us. It seems to be the consumer mindset has shifted, not just in dentistry, I mean, clearly in all industries and in all verticals across the country. So, we noticed it coming out of COVID, and no-shows, cancellations for me, like many of you, are a huge, thorn in my side. And so I immediately sat down with my director of operations and I started by dissecting what we were doing and creating a strategy to start attacking the problem. And, we tried different things. This worked, that worked. And then we ultimately got our cancellations from about a 12 to 14% down to about 8%. And so for us at a group our size, seeing roughly 27,000 appointments a year, that's a significant impact to our business. So that's how we got into it. Here's just a little bit of data that I found. We work with Dental Intel a lot. We run all of our KPIs, a lot of our bonuses through Dental Intel. And, when I was preparing my article, I kind of called them and said, hey, I know pre-COVID, it was 10%, like we should be under 10% with no shows and cancellations. What's it now? Because we had to do everything in the world to get under 10%. And before COVID, it wasn't that hard. And they said, oh, no. Now 11-15% is the average. If you're 10% or less, you're doing really, really good. So that was really eye-opening for me when I had that. I did not expect to hear that from them when I reached out to them. And I think they've got 8,000 or 10,000 offices across the country that they pulled data from. So again, like I mentioned, we got our numbers down to about 8% from about 12 to 14%. We have 27,000 appointments per year. I think we did that many in 2022, so we're above that now. And our average appointment value is $310. So you take 8% of that at $310. That's about $800,000 a year in revenue it cost us. Another friend of mine, Dr. Roger Levin, has done a study on this and said the average practice in America, a single doc practice, is going to lose about $3 million in a lifetime to no-shows and cancellations. So it's a big problem, and a small change can have a big impact to the bottom line of the practice. So what can we do? So as we mentioned, and Carrie and I had a lot of preparation for this, and what we both agreed fully on was that prevention is absolutely key with cancellation and no-shows. You got to have a plan. You got to stick to your plan. You got to train your team. You got to have your team stick to the plan and the policies that you've set up in order to help prevent these cancellations and no-shows. If you don't have a plan, this is going to be a huge problem. It's going to cost you a ton of money. So step one is to have a plan, and we're going to kind of help you talk through 10 steps that we've come up with to help mitigate some of the risk. So we're going to go through those 10 strategies for kind of reducing your risk to cancellation and no-shows. They may fit perfectly in your practice. You may tweak them. You may find some work for you, some don't. But these are what I did in my practice to kind of get this under control, and it worked for us. So step one, be strategic about scheduling your appointments. You'd be amazed how often you tell a patient tells you, or you ask a patient, hey, it's January 1st today. What is it, June or July 1st to 6 months later? How does July 1st work at 10 a.m.? They go, oh yeah, that works. Cool, no problem. If you ask them to pull up their phone and double check their calendar, you'll be amazed at how many times somebody will say, oh, actually, never mind. I have another appointment, or I'm out of town that day. So just having them double check their calendars, you'll be amazed at how often that time that they schedule without checking gets changed. Also building value in the appointment. If Betty calls to cancel her filling or her scaling and root planing, you want to reiterate the importance of why that filling is important. Betty, we would hate for that filling to get deeper, cause a root canal, cause you pain when you're unexpectedly when you're on vacation. So, you always want to be establishing the value in that appointment so that they tie the importance of dentistry to that appointment. Otherwise, like you all know, dentistry goes to the bottom of the list and is the first thing to get canceled if they don't understand the importance of why they're coming. So, the last thing I'll mention with this is just make sure, and I repeat this a few times, actively encourage them to sign up for those text and email reminders. They can opt out of them, but they're going to do a much better. You're going to have much more control over the reminders if they're opted into that instead of just relying on them reminding with a little card. So any thoughts there?
Yes,
Carrie?
I love that, Dr. Wells, and really couldn't agree more with what you're saying here. A lot of what we teach at Jameson has to do with our verbal skills in how we're scheduling appointments, how we're confirming in that face-to-face or in that voice conversation with patients to build the value of the appointment before they ever step foot in the door, hopefully step foot in the door, right? And so our verbal skills are so pivotal in helping to build value, or they could just as easily diminish value. So when you think about how you're speaking to patients on the telephone, or even when you're scheduling face-to-face, because the best way to schedule an appointment is face-to-face. And so how proactive are we in our value building verbal skills when we're reappointing a patient for their next appointment, or scheduling the treatment that they're committing to when they're in the office with you, but also when they're having those conversations on the phone to schedule appointments. We want to make sure that we are practicing as a team strong verbal skills. In fact, there's a book by other fellow Okies, or one Okie, Jeremy Kubicek, and a business partner of his, Steve Cockram, that talks about, it's called The 5 Gears. And there's a piece in the book where they say, where in your life are you living intentionally and where are you living accidentally? And so I love to take the layer that they talk about of where in our work are we working and communicating intentionally, and where are we working and communicating accidentally? Chances are, if I step into your practice and I listen to your conversations with your patients, I can identify a lot of accidental communication where Dr. Wells is talking about having them double check their calendars. That's an intentional piece of conversation. Emphasizing the value of the appointment, that is also very intentional. Actively encouraging the signing up for reminders, that is intentional as well. And remember, if you have patients that have opted out for that in the past, there is nothing that can say that you cannot revisit that option with the patients the next time they're in the practice, or the next time you speak with them. Perhaps they didn't know why you were asking to be able to send them reminders. And we can explain the why behind the what, so they actively engage and agree and commit to a best way forward for us to stay in contact with them, to assure they remember that they have an appointment coming up. I read a study saying that we may be living in an epidemic of forgetfulness. And so we want to make sure we utilize the tools and resources that we have access to but also use the verbal skills to empower us and empower that conversation to get a stronger commitment from the patient.
Great. So great points there. So that's step one, 1 of 10. So the next step is get new patients scheduled fast. So you might have guessed it. One of the top 2 highest risk patients on your schedule for cancellations are new patients because they don't have an established relationship with you. That's an easy appointment for them to cancel. They've never met you before. They have no connection to your office. One of the most important things you can do with a new patient is get them in quickly. So our rule in my practice is we have an 11 business day rule. So if we're at 11 days and we can't get a new patient in, we have no spots for new patients at 11 days. It's time for us to expand capacity. We're either expanding that office or we're adding a new office, whatever it takes. But we've got to get those patients in 11 business days or less. Now you might find it's 8 days or 15 days, whatever works for you. But when you're having a new patient schedule and you're booked out 2 months, I mean, great for you. You got a really busy practice, which is awesome. But there's just a much higher chance that they're not going to show up for that appointment 2 months later. They're going to forget about it, or they're going to have found a dentist like me who got them in 11 days or less. So trying to get them in expeditiously is going to have a much better return on them actually showing up than getting them in an appointment further down the road.
Yeah, spot on, Dr. Wells. If you can't see a new patient in the next 2 weeks, you're in trouble because if you're wanting to grow your practice with new patients, listen, they have urgency now. They want to be seen now. Great customer service answers the question, how easy do you make it for a person to get what they want or need? And just as Dr. Wells said, we don't have the relationship with them yet. So what's their commitment to us? None. So they don't want to wait. They'll go on to the next person. So that's why when you're thinking about the essentials of effective scheduling, that we are pre-blocking our schedules to incorporate new patients as quickly as we possibly can. And if there are any specialists that are on this webinar, I don't know if you're there, shout out if you are, but if there are any specialists here, this is really important for you too, for your referring doctors. Your referring practices want you to be able to see their patients as quickly as possible. So when you think about that customer service element that you're bringing into those relationships, your expediency to see their patients is top of the list for them as well.
So great idea there about pre-blocking appointments for new patients. We haven't done that. I haven't even thought of that. It's a great idea though. So,
Yeah.
little golden nugget for everybody right there.
There we go. Perfect.
Yeah. So making it personal. This was a tough transition for our team, remembering we're not calling to confirm your appointment. We're calling to remind you of your reservation with Courtney on Thursday at 2 o'clock. She's so excited to see you. You personalize it. You remind them that you're reserving time for them specifically with a specific provider who they do have a relationship with. So changing that verbiage changes their mentality, and it's not, hey Betty, we're calling to confirm your appointment on Thursday at 2. Is that still a good time for you? You're almost like giving them or like asking them to cancel the appointment almost. And that's how we did it for years. We were making that mistake. So getting our team and our text messaging and everything to change over from confirmation to reservation and adding a team member's name to personalize it really helped connect our patients to that appointment. And I'm sure helped in our process of lowering our cancellation rates.
Yeah, I mean, I agree. See, we have more in
A
common
lot
than
we
you
agree
think,
on.
Dr. Wells.
Yeah.
So
Yeah.
completely agree, because if we can, pull the power, so to speak, of the provider, that is the relationship that person is coming into to connect with. So Dr. Wells has reserved 90 minutes of his time and will be ready for you and prepared for you when you arrive. Can we count on you to be there? And I want to encourage you again to think of your verbal skills, redefine what that sounds like that is ideal. If you have resources where you can either call and practice with each other on those conversations or listen into how those conversations are going, you will be surprised at how often we backpedal and use what we would call diminishing words. Just wanted to make sure we're very hesitant to be assertive in those confirmations. And I want them to be pleasant, of course, and professional. And using words like reservation and using those providers' names really helps to elevate that sense of value for what they've committed to.
Yeah, the more personal, the better. And,
Yeah.
as you mentioned, there's nothing to learn more about your practice in the world than listening to phone calls.
Yes.
Holy
Oh,
cow, do you pick
and
up a
it's
lot of
so
stuff.
uncomfortable. But
Yeah.
if the only way that we can all be better is if we can be coachable.
Yeah.
So, is your team coachable? Are they open? Are you coachable? Are you ready to look, listen, and learn of how you can improve what you're doing now to be just a little bit better next week? It's all of those tiny disciplines that you improve. James Clear, Atomic Habits, says whatever you want it to be, whatever your goal is you have in mind, it's the tiny disciplines and tiny improvements that you make and commit to along the way that's going to get you to that new habit. And so verbal skills in the dental practice are some of the hardest for people to break through and level up on, because it's so uncomfortable to practice, and they don't, and you don't. And so when you do, when you find these high performing practices, that those that are getting 10% or less, chances are they are practicing those verbal skills regularly to make sure that when they're in those conversations with patients, it's spot on.
Yeah, and don't forget also the copy or the text messaging, updating the verbiage on those in your emails as well. Uh,
Yes.
really helps. It's a multi-pronged approach there. So having a policy now, it's hard to have a policy in place without a written form, right? So when patients come in as a new patient, having that policy in place, we're going to talk about deposits, cancellation fees in just a minute, but you've got to get that stuff written down on a document, signed and initialed. For us, we have a 48-hour cancellation fee that gives us enough time. We do take deposits for bigger appointments. We'll talk about that in a minute. We lay all that stuff out and have them individually signed, so that if later, they've been no showing, canceling multiple times, and they're really upset about a cancellation fee, we can remind them of the paperwork that they signed. And, one comment here is we all get them. We'll get them every once in a while. A patient just says, I'm not going to sign this. I don't agree with that. Okay, fine. This probably isn't going to be the right practice for you. And we have kind of a hard line with this. It's our policies, and I've had most of these policies for, I don't know, what have I been in business for? 16 years now since we've been in business, and they've worked really well for us. So have a policy in place, whatever it ends up being. You might not be on the cancellation front. I know Carrie's not a big on the cancellation fee. That might not be a part of your paperwork, but whatever it is, have it well documented in your new patient paperwork. And as you change it, have it re-signed by your patients. We went from $50 to $75 post-COVID, and we had to have everybody re-sign it, and that was a lot of fun, but we got it done. So yeah.
I would say yes. And again, here comes the verbal skills police. But it's really about being practiced and comfortable and competent in these conversations. Mrs. Jones, Doctor, we are thrilled that we have this time reserved with you. Dr. Wells will be looking forward to taking care of you next Thursday. I wanted to make sure you are aware, as always, that we do ask for a 48 hours notice should anything happen between now and then where you would be unable to make your appointment. Now, I have you confirmed for next Thursday at 2 p.m. Do you see any reason at this point why you would not be able to make that appointment? No, I think I can do it. Then can we count on you to be there? Or if you aren't able, will you please make sure to reach out to us within 48 hours so that we can make sure another patient has the opportunity to take that very valuable time? Yes. And I want them to say yes, because just as Dr. Wells is saying, when they have patients sign it, it is a physical and verbal behavioral commitment. It's almost a psychological commitment that patient is making with us in that relationship. And I hope that you heard those verbal skills. It was very professional. It wasn't punishing. It was simply, we are reserving this time. I'm sure you can appreciate that. Do you see any reason now why you couldn't make it? Just like Dr. Wells was saying earlier, let's check your calendar, make sure you truly can be here in that time. It's really engaging and partnering with them in a different way in these conversations to ensure we are truly in a collaborative agreement.
Making it personal, building value. The soft skills are what's really going to win the day with these appointment cancellations and no-shows. So for us at our office, and I've done this from day one. I can't remember who I listened to 15 or 20 years ago that recommended this, and it's been so instrumental in us and not having, we very, very rarely have a cancellation or no show with a larger appointment. So for us, it's a larger appointment. Any appointment that's more than an hour, any appointment that's larger, maybe, you know, Invisalign impressions that might be less than an hour, crowns, root canals, implants, any number of things. It's a larger appointment from us. If it's a, you know, occlusal composite on number 15, we're probably not taking a deposit. But for any larger appointment, we do take deposits, and that's something that we audit and make sure our teams are doing. Because 9 times out of 10, if we do have one of those big appointments cancel, and it's incredibly rare for us, when we check that account, there's not a deposit on file. So deposits are really key. It's, again, makes patients very intentional. They have to pull out their credit card and put money down to schedule the appointment. They're going to double check that calendar and make sure everything's good to go before they schedule it. So deposits for us have worked very well. Now, there's another school of thought. I think Scott Loon at Breakaway mentioned this when I was at one of his courses, where they have you pay your full out of pocket ahead of scheduling all appointments. For us, we looked at that, we toyed with that. The operational changes it was going to require from us was just prohibitive, and we weren't at a point where we were ready to do that. But at a smaller practice, it might be something. Carrie might have some comments on this, where it might be appropriate. It might be easier to accomplish than us at a multi-location larger group.
Yeah, there's a lot of, you know, kind of methods to this, but the direct answer is that the deposit is really helping to make that commitment even stronger. What we know from a behavioral sense is that when people complete things or commit to things or invest in things prior, there's a much higher level of commitment to whatever they're moving forward with. Even with new patients, if we can work on our verbal skills when we're scheduling new patients, and we can get them to complete their new patient information and health history prior to the appointment, to me, that is a much higher confidence level that new patient's going to keep that appointment because they did their homework, right? They're committed in that way. Same with deposits. You know, deposits can also be a part of a financial option of how patients can take care of treatment. To Dr. Wells's point, if these are larger restorative cases, you can spread payments out they can put an amount now to reserve that first appointment. They can pay more at the next appointment, and we can create financial arrangements that help spread out payments even a few weeks at a time to help make that more feasible for them. There's a lot of ways that you can do this. But I'm definitely pro deposits, especially for that restorative kind of treatment, as Dr. Wells said, to help solidify and ensure we're really committed to this. This is not a false yes from the patient. We're getting those financial arrangements in place, and they're also putting down a financial commitment to say, yes, I'll be here. Yes, I'm committed to this treatment.
Great. Perfect. So, all right, confirmation protocols. Now, I can tell you, we tried so many combinations here. Over the 6 or 7 years we've done this, we have tried combination after combination. This has been our protocol for the last probably 3 or 4 years. We would know we needed to tweak our protocol when we get patients calling, complaining about how many reminders they were getting. You guys have probably gotten that, but we used to get people calling and complaining about reminders. We would tweak it, and we very rarely get calls about that now. And here's our protocol. We give a 2-week reminder, and we work with Modento to do this. I know there's a lot of different companies that do patient engagement software that automate this stuff. That's just who we use. But at 2 weeks, they're going to get a reminder, text and email, not a confirmation, just a reminder. At 1 week, we're going to ask them for a confirmation. You know, reservation scheduled with Courtney in a week, yada, yada, yada. Please press 1 to confirm, 2 to cancel, or whatever. If they haven't confirmed at that point, at 3 days, they're going to get another confirmation email, confirmation text and email. At 2 days, we pick up the phone. So if they still haven't confirmed at 2 days, we're picking up the phone, we're calling them, because at our office, we'll talk about next, that 2-day mark is when, you know, we require notification if they want to cancel. And so we want to make sure we've done everything we can to give them the opportunity to cancel if that's what they intend to do, and give ourselves the opportunity to rebook that appointment. Now, at 3 hours, we pivot back to a reminder where we remind them of the appointment. I think we've given up if they haven't confirmed yet on actually getting it confirmed, but we're at least going to remind them that they have an appointment coming up in 3 hours. And as we'll see, sometimes people have confirmed and then they forget last minute. So the 3-hour reminder is also critical. And then also practice, practice, as Carrie's mentioned several times, the verbiage and the soft skills that your team need to use if your patient does call to cancel within that 48-hour window, rebuilding the value of the appointment, why it's so important to get in. A lot of people will use this strategy. A lot of offices will use the strategy. If they cancel, don't allow them an appointment for a couple months. We don't do that. I know some people have used that strategy and had some success with it. But just building that value and creating some friction against them canceling the appointment, you'll be surprised how often you can recapture those patients.
Yeah, I think it's great that I think your protocol, Dr. Wells, is great because you're consistent. It's working for you. At Jameson for hygiene, we say, that first text or that first outreach of a reminder is 2 to 4 weeks prior. So that's pretty, that's right on par with what you're saying. And then also 2 days prior. So we're really pretty close there. And then restorative at least 2 days before, because if they have an aha moment of like, oh gosh, I want at least 2 days to work on on filling that void if I must. I love all of this. I also think this supports what you had said in an earlier slide and recommendation of really take a look at the messaging of your messages. So many practices simply plug in and forget and use the automated robot response. And listen, we're getting a lot of that. Human beings are getting a lot of that noise now. So how are you cutting through the noise by being more intentional with not only your verbal skills, but your written word, so that we are that pleasant yet strong reminder that this is something that we have committed to. I see some great ones. I see some great messages. I see some not so great. I see those that are putting forth the effort to make it more effective for them. And I see the ones that are simply just accepting it and normalizing that this is the way it is. And I believe what you're all doing tonight is making a choice to own your goal. Have a mindset shift yourselves of this doesn't have to be the way it is. Look at your stuff, just like Dr. Wells did. What are you doing? What's working and what's not? And how can we maximize these tools in a more effective way? And your confirmation protocol is probably one of those areas. And you can sit here and you could tell the two of us all of the reasons. We've heard them. But the fact of the matter is, have you improved what you're doing right now? No change means no change. So if you want an increase and an improvement in your kept appointments, then start looking at these things and what can you be doing better, and learn from people like Dr. Wells that are having success. You don't have to do it exactly the way that he does, but I guarantee you there's something about your confirmation protocol that could be improved.
Great. So this is where Carrie and I will diverge a little bit, and I think that's okay. We've talked about this. I have had a cancellation fee from day one, and that's just been, and I've heard every, different opinion on this. It's just been my opinion from day one in our practice. We charge a $75 cancellation fee. Shortly after COVID, it was nearly impossible to do this. We've gotten back to it. We typically will we used to give everyone, no matter what, one freebie every 2 years. Okay. If they no-showed, if they called, we gave them one freebie. We have stopped. We called a no-show, no call. So if you no-show, no call, we're implementing that fee. Now, we do have people sometimes afterwards will call and give us an explanation for why they no-show, no call. But if you no-show, no call, we're gonna hit that fee. And if you call, give us any reason, sick, emergency, work thing came up, we're gonna do our verbal skills to the best we can to help provide some friction to get you into that appointment, and oftentimes that works. But if you just ultimately can't come in, we do give one write-off or one freebie and let them know about that, and then on that second appointment we charge them the $75. Now, one little wrinkle I put into my team is I said, look, you guys can't, our schedulers and treatment coordinators can't give them can't waive it. But what you can say is, I'll speak with my manager and see if we can get that one written off. And then she pretends to go and she or he pretends to speak with the manager and calls them right back and lets them know that it was okay, just to build the importance of why it's so important they come in and how, we're trying to do everything we can to avoid that fee for them. But yeah, we'll talk about dismissing patients in a minute, but we've kind of defined out our process from, giving them the benefit of the doubt to charging to kind of the same day call list that we do. But we notify the patients ahead of time. It's on their new patient paperwork. And the cancellation fee nowadays is becoming much more common, even in restaurant reservations. I know whenever I go get a spa or massage, if I cancel last minute, I'm getting charged that full fee for that massage. So it's becoming a commonplace since COVID. That's one benefit, in that it's not so unusual anymore to charge these cancellation fees, so patients are more used to it. Doesn't mean they're happy about it. We definitely get earfuls a lot when we do charge it, but it is a little bit easier these days. We would much prefer them to show up, and we do everything we can to do that, but that's what we do. Carrie, I know you've got a different opinion, so
now I know a lot of practices do this and it's successful. So I'm fully aware that I am, maybe I'm an outlier, but what I am very passionate about is that we use this as a last resort, because I am more interested in us being proactive. This follows into what I call the reactive category. We are so frustrated with how things have shifted, the mindset of the patient, the behaviors that we actually allowed happen during COVID. I'm not saying it wasn't the right thing to do. We all had to do that. And now we have to reset the mindset of the patients, of the value of these appointments. At Jameson, we believe in what we call the 4 pillars of a healthy patient practice partnership. And those pillars are that the patient trusts us, they see urgency in their treatment or their relationship with us, they see a need for it, and they see value in it. And everything that we do in that patient experience is either building those up or diminishing them. And what we know also from the ADA is that the reasons patients forego treatment is cost, fear, and time. And so we want to make sure that we're delivering an experience that hits the marks of the pillars, but also addresses the needs and the obstacles that the patients have to accessing care. And so I'm all for deposits, and those deposits are going to go to the fee for the treatment. And those deposits don't come back. So if they skip an appointment, it's really, they've made a deposit that they're not going to see again. And so, but I'm all for deposits. And I simply believe, and studies in the medical realm show that there is a direct correlation between patient satisfaction. So our patient satisfaction in their care by us, patient trust, how much they trust us. There's direct relationship between those two things and patient commitment. So if we work on our verbal skills, there it is again, and the experience that the patient's having, and it doesn't mean that we're not going to have some important conversations with patients to understand the value of what they're committing to, and make sure that their yes really means yes, I'm coming, and get that commitment from them. But I'd like to exhaust all other ways to help that patient see the value in that commitment before this. Simply that, but also knowing that this works for practices. So you do you, people. What does right look like for you? That's what we want to know. What does right look like for you and your practice? And what do you need to start to implement, improve, or change to get closer to that ideal?
both strategies I think can be very effective. The communication skills need to be really on point if you're not going to do the cancellation fee. And I think actually, if you've got the communication skills to do it, that's the better route to go. We did have one question around accepting state insurances and not being allowed to charge a cancellation fee. I don't know what state insurances are in the state, or if it's like a Medicaid type thing where there's no out of pocket. My only advice might be just to collect that copay ahead of time for all appointments, maybe. And I think even if you're not allowed to keep the copay if they don't show up, putting the money down in my experience has been a very strong determining factor of them showing up, and is an incredibly intentional decision on their part. So if you're worried about that and can't charge a cancellation fee, I mean, I would be a little firmer on the dismissal of patients, I guess, if you can't do that. Really, really hone in on your verbal skills, and maybe even consider collecting the full copay ahead of time when they schedule.
Yeah, and if I can just add to that, Dr. Wells,
Sure.
typically if this is a Medicaid type situation or Sooner Care, which is one in Oklahoma, the next slide actually, so you can move on to the next slide, Dr. Wells,
Okay.
is probably more of what you're going to see. This is one that Dr. Wells does a little differently than we at Jameson typically see or incorporate. Except for when you're working with Sooner Care, Medicaid, we do see practices that utilize this because there is such a higher tendency for cancellations and no-shows for various reasons with patients in those types of plans. So the double booking approach may be a solution that if you're not already doing this could be a help.
Yeah, and to be honest, we don't do double booking unless we're doing assisted hygiene. I've tried to, my team I get so much pushback for that rare case, or not rare case, when both patients show up. So we did a big study across our offices over 6 months. So I mean, we're talking like 10,000 appointments. And we looked at all the cancellations and no-shows and what they were attributed to. And what we found is probably pretty obvious to everybody. Are going to no show, at least in our practice. They do. We have an insurance driven. We don't take Medicaid, so we have a higher show rate, but we have very insurance driven practice. 80 to 90% of our patients have some version of dental insurance, probably more like 80%. But we found a third of our unconfirmed patients no showed. 12% of our new patients no showed. So those are our two highest risk. Hygiene patients were next, which I kind of thought it was going to be inverse of this. I thought it would be restorative next, but I was proven wrong. Restorative patients are down at 6%. So if you're going to double book, consider those unconfirmed patients. If you're booking patients 2-3 months out for new patients, that 12% might get a lot higher. For us, we get them in a lot quicker. So it's probably less there. We did run the data too, and I'll talk about this later with membership plans. Our members cancellation rate is like less than 2%. So talking about something that builds value in your practice and creates loyalty, your subscribers who are paying every month, whereas, dental insurance is often gifted to our patients by their employer. Membership plans are paying for, and so they're showing up to those appointments. So just some data here. If you want to consider double booking, just have a plan in case both patients show up. It's easy to create a plan where you're going to slide the patient into, who's going to see them if they both show up. So just a word of caution there if you do it. And then this is something that all of us, I think, have a real hard time with. And we had to create systems and documentation and paperwork around it because, I'd come into the office some days and you guys have patients like this where it's like, Betty and her 2 kids and husband, between the 4 of them, have missed 6 appointments a year for the last 3 years. And it's just like wrecking your schedule. I mean, you're losing 4 times as much and chair time and whatnot than you're gaining by having those patients. And you just continue on because you don't have a good system in place to part ways with those patients. And at a certain point, if they're not going to respect your appointment time and your time, you got to have a point where you break up with those patients. And so at our practice, we give everybody and we kind of reset things in 2 years if there's been no issues, which is just an arbitrary thing for us, no real data behind it. But in our practice, we give them 1 courtesy write-off as long as they call the practice. Then we're collecting that cancellation fee. If they pay it and then no show again, so we're talking that they've been given a warning, they paid a no-show fee, and then they do it again, then we're going to put them in a 2-year period. We're going to put them into that same day only status, meaning they have to call same day and see if we have an opening that they can come into. Basically, they've lost the privilege of scheduling an appointment in advance of our practice because they've missed so many appointments. And then if they cancel that one, then they're getting the letter. We can't see it here anymore. So that's our protocols that we've worked on over several years. It seems to work pretty well for us. We don't get to that point of a formal dismissal very often, but it does happen. But you got to have that line in the sand. And Carrie, I'm interested to hear your opinion on this. It might be different from mine, but in mine is you got to have that line in the sand at some point.
super aligned here. Once they become repeat offenders, they don't get to have your golden appointments. You have a lot of amazing patients that are wanting those time frames. And so, Mrs. Jones, I'm sorry to hear that we're not going to be able to make this work today. This was some verbal skills that you were asking. Let's just go through this. Oh, Mrs. Jones, I'm so sorry to hear that you're going to be canceling your appointment for this afternoon. I'm sure you can appreciate that when we committed to this together prior, when we were scheduling this, Dr. Wells, really the importance of having this treatment done is going to be going to make the difference in you being able to get function and relieve you of that pain that you've consistently been struggling with. I'm sure you can appreciate that's a great deal of Dr. Wells's time. Do you see any way that you can make your way here? I'm sure you can appreciate that that would be a real disappointment for us. Is there anything I can do to help make sure that you can get here? And I want to be using all of those types of, I'm pulling Dr. Wells in, I'm pulling the time in, I'm pulling patients that were wanting that time. When I'm pulling them back in, that they committed to this. And when we last talked, they said they could make it. Tell me, is there any way that we can get you here because you simply had the epidemic of forgetfulness? And then if there are those repeat offenders, it's 3 strikes and you're out. Same day status, 3 strikes, you're out. They are proving, when they show you time and time again who they are in relationship to your practice, believe them. And, you've, especially with so many practices that are struggling to see patients in a timely fashion because you're so far booked out.
Yeah.
What are we doing here? And having those, working again on great verbal skills and a great process and making sure the patients understand. And Mrs. Jones, this is the second time that we've had to reschedule an appointment for you. I'm sure you can appreciate this is a concern for us because we want to take care of all of our patients in a timely way. And every time we lose this opportunity with you, we've also lost an opportunity to take care of somebody else. So we have one more opportunity. Can we count on you to honor this time that we are committing to work on together? And you can count on us to be ready for you as always. So working on these types of verbal skills to help you be comfortable with this, but understand high-risk patients, you're rolling the dice after a while. And we want to get more of those ideal patients that not only make appointments, but they keep them.
100%. I'm glad we're aligned, that I'm not like out on right field somewhere looking like the idiot dentist, booting people out of practice. But it does make sense to me, and it's just really frustrating for me. And I'm sure some of you, for those repeat offenders, that nothing seems to work. The verbal skills, the penalties, nothing. So I'm gonna hit number 10 because some people might need to get off, and then I know we've got a few questions. Number 10, as you might have guessed, implement a membership plan. I can't tell you how powerful this was for us through COVID when we continued to get our recurring revenue and I had no other sources of revenue really coming in. And then post-COVID, as we evaluated our practice and saw cancellations go through the roof, and we broke it down by appointment types and patient types. And one of the patient types that we evaluated was our members, and found that we had a less than 2% cancellation rate of our members. And that was just like, there's a lot of reasons why membership plans are awesome. Increased treatment acceptance, they come in more often, they're loyal patients, they stay in your practice. But we had no idea that they were actually going to be better patients in terms of showing up to their appointments. I mean, it makes sense, but we didn't understand how drastically better. It was just another feather in the cap for what we've always believed was a really strong program in our membership plan. So if you don't have one in place in a strong membership program where you're getting all of your uninsured patients into the program, have a strong program in place. There are so many benefits of this program for your patients and for your practice, and they're kind of behind the scenes benefits. Like, you probably aren't calculating the fact that less than 2% of your members are no showing and canceling appointments, whereas your insured patients might be 8 to 15%, right? So you're not calculating the fact your members are converting 2.5 times the amount of treatment as non-members. So there's a lot of these things that if you're not calculating, you might go, why do I have a membership plan? But we can tell you the data shows these patients are much more valuable patients in your practice. So very, very important to have a membership plan. We'll talk about the benefits of DentalHQ in just a second. But before I do that, I know we had some questions, and someone asked us if we could kind of role play somebody calling to cancel. And Carrie, you're so much better at this than I am. I'm going to play I'm gonna play the patient,
Okay,
and I'm gonna let you play the scheduler trying to get me not to cancel.
sure.
So ring ring ring.
Thank you
Uh,
for thank you for calling Dr. Wells' office. This is Carrie. How may I help you?
Hey Carrie, this is Brett. Hey, I wanted to call and let you guys know I've got an appointment later today, but I have a really important business meeting that's come up. I just am not going to be able to make it today. I'm so sorry. I'll call you guys back when I can make it, but I'm not going to be able to make it today.
Oh, wow, Brett, I'm so sorry to hear that. When I spoke with you yesterday and we confirmed this appointment, you felt pretty confident that it was a yes, and your appointment's in 1 hour, and I'm sure you can appreciate Dr. Wells has been preparing for you, and we have 90 minutes of his valuable time reserved just for you for today. Are you sure there's no way that I can coerce you to make arrangements so that you can follow through on this committed appointment?
Well, I mean, it's a really important meeting for me. Is there any way I could get out of it today and I'll call you back when I'm ready to schedule?
Well, I know Brett. Because I know you and I know how demanding the work is, and I'm sure these last minute meetings come up all the time. But I'm sure you also appreciate that when we discussed this time, we asked if there was any reason why you couldn't make that appointment, and you said no. And so I'd love to be able to make a way for you to come and keep this appointment, because until we can get this appointment taken care of, you're going to continue to be in the pain that you were in when you came in to see Dr. Wells for that emergency a few days ago. So what can I do to help you make this appointment? Is there any way possible that we can make this happen today?
You're right, Carrie. This tooth has been bothering me. Do you have anything like maybe 30 minutes later that I could come in, or maybe an hour later in the day available?
Well, let me look at let me just give me one moment and let me look at our reservations and our schedule and see if there's a way that I can make that work. Can I give you just one moment, Brett?
Sure.
Okay. So to me, we're working in a direction where Brett's going to come. And what's going to happen is I didn't back down until he was like, there ain't no way, lady. It's not going to happen, because, there are obviously circumstances that are outside of our control, that they're not going to be able to be there. If Brett's meeting was in Indiana and he was on an airplane right now calling me, that's obviously not going to happen. But what I would want to do then is I would want to make sure, if he's not a repeat offender, if this is first offense canceller, and he's typically a consistent and committed patient, I'm going to make sure I reserve the time while he's on the phone. I'm not going to get can I call you back? Nope, Brett.
Yeah.
It's my responsibility to make sure that we get this dentistry taken care of. You've asked us to help you, and it's our commitment to you to make sure this gets done. So I am going to make sure we reserve and reconfirm another appointment with him, and then making sure we have an ASAP list and that we're scrambling and we're working to fill that void that has now occurred, should I not be able to turn that around. What I see happen a lot in practices is we quit before we even tried to challenge that
100%.
cancellation.
Yeah.
Oh, you have a meeting now. Oh, well, okay. Do you want me to go ahead and reschedule that now or
Yeah.
later? What's Brett going to say?
Yeah.
Brett's now in control of my life.
Yeah.
And so we need to make sure they understand the value and the commitments that we've worked toward. And that's why it's really important to have great verbal skills long before that conversation that we can point back to. Did you hear me say, remember when we talked about this 2 days ago, Brett? Remember when you told me you didn't see any reason why we couldn't keep this appointment? And so I'm bringing him back to the agreements that we have had together along the way.
Yeah. So again, don't accept the requests at first request. Build value in that appointment and make it personal. Help them understand the importance of why to get in there. I think for being 8 o'clock at night, Carrie did an amazing job convincing me to come into the appointment, and she saved the doctor's time. So good job there. Just to recap, Carrie, you want to run through the recap real quick?
Absolutely. So remember to be strategic about your scheduling. At Jameson, we teach essentials of scheduling. Just like we talked about when we were talking about pre-blocking new patient appointments, a lot of things that you can be more intentional about here and strategic. Be strategic in your verbal skills and how you are initially landing that scheduled appointment with that patient. Make sure they understand what they're agreeing to and that we are building value, building value, building value through that conversation. Getting those new patients in as quickly as possible. Time is of the essence with new patients because we have no trust, we have no value, we have no urgency, we have no need with them yet. We haven't had the opportunity to build that relationship. Make it personal. Look through your communications and how can you level it up and make it a more personal experience in every aspect, even your automated communications. Have those policies in place, collect deposits, have a confirmation protocol. Go through that protocol and make sure it's working well for you. And how can we adapt that to get a better result? It may be that you're not chasing down that confirmation. I always like to say our business team sometimes behaves like bounty hunters. We're going to track these people down and we're going to get that confirmation one way or the other. Instituting a cancellation fee if that fits your vision and your philosophy of practice. But remember, I'm going to go ahead and insert be proactive first. What have you done before then to reduce the need for that fee? Consider double booking, especially for an example, the person that you may have be in some plans that would be beneficial for you. But remember, just like Brett said, that be careful with that you don't naively double book and then start to punish your other committed patients by starting to run behind or seeing patients that you cannot truly see in the allotted time. 3 strikes, you're out. High risk patients, they start to become put on a same day list because they're not honoring the agreements that we have between each other. And implementing a membership plan. I'm so thrilled to be on this with you, Dr. Wells, and I'm so thrilled to see that we are beyond early adopters in incorporating membership and loyalty plans into dental practices. You have patients that can truly benefit from this resource. They're looking for these types of opportunities. And this is such a huge customer service piece. And remember, great customer service answers the question, what are we doing to help the patients as easily as possible get what they want or need? And I am a full believer in a membership plan is a huge customer service tool that your patients will be grateful for.
Yeah, really have revolutionized dentistry and are the future for healthcare, in my opinion. So just a quick, and we'll have you guys out of here in like 2 minutes, but DentalHQ, I know you guys, there's a lot of options out there. We were founded back in 2017 by a dentist, and through real struggles that I struggled in my practice, we've continued to tweak and modify the software to something that I really think is best in class. It's the best software out there. We do PMS integration. We do all your payments. We give you reporting. We have a nice platform with widgets that you can customize. We just launched something called a guaranteed plan payment. So if you put a patient on a 12-month membership program and they stop paying, their credit card goes bad at month 3, you continue to get payments for the whole year through this program. So you don't have to worry about patients not paying you. You're going to get paid for your membership plan for the full year and recurring after that, whatever the patient signs up for. We've got awesome technology around taking your membership plan out to the community and creating programs for like the YMCA and special discounts and whatnot. So we're much more than just an automated solution that does the payments and reporting and tracks your members. We train your team. We provide marketing materials, everything you need from A to Z. So if you're thinking about doing a membership plan, if you have one, you want to take it to the next level, you're working with somebody else and you want to work with best, give us a call. At the end here, we've talked about this already, so I'm not going to go through all that. At the end here, we've got our emails. You can reach me. I'm Brett at DentalHQ.com. You want to talk membership plans or dentistry in general? I love to chat. So reach me there. And then you've got Carrie here with her email. And again, I'm so excited I got to share an evening with Carrie and with all of you. I think this was a very helpful and hopefully informational webinar that everybody got to take at least one thing, if not a lot. My last comment, and then I'll let Carrie finish, is this is not a single pronged approach. This is something that for us took many, many, many tweaks to finally get that number down from 12 to 14 to 8% for us. Okay, consistently 8%. We had to do a lot of different things. This isn't just changing your confirmation protocol and you're good. Like it's a lot of things stacked on top of each other that if you do everything, continue to work on it, you'll see those numbers reduce, and that has a major impact to, I know we don't like to talk about revenue, but has a major impact of filling your chairs, driving revenue, and ultimately the bottom line of your practice financials. So I appreciate your time, and Carrie, feel free to take the
Yes,
last
no.
comment.
Well, thank you. And thank you, Dr. Wells. And thank you to DentalHQ for the invitation to be with everyone this evening. Thanks to all of you for joining us. Dr. Wells is absolutely right. Really, the key to success in your practice is to take a step back and look at all the pieces of the puzzle. Where are you doing well? Where can you improve? Every piece of a patient's interaction is making or breaking their sense of value, of their commitment of whether they're going to keep that next appointment. From how you answer the telephone to how we schedule the appointment, confirm appointments, take them through their appointment, present treatment, make financial arrangements, schedule the next appointment, the patient checkout, the patient follow-up, all of those pieces are creating that narrative in that patient's mind of whether they're going to commit to that next appointment or not. So I would want to encourage you to go back, sit tonight, and then go back with open eyes tomorrow and see from the lens of the patient, how can you deliver everything that's expected plus a little bit more? And go Thunder.
Go Thunder. Thanks, everybody.